So, hi Pooja, thank you so much for joining us today.
Yeah, thank you for having me, Mia. I'm really excited for this conversation.
Yes, me too. So before we get into the interview, I'd love if you could just share a little bit about, who you are with our viewers.
Yeah, absolutely. I'm Dr. Pooja Lakshmin. I am a physician psychiatrist specializing in women's mental health and perinatal psychiatry. I am also the founder and CEO of Gemma, which is the first digital education platform focused specifically on women's mental health. I also do a fair bit of writing. I'm a contributor for the New York Times and have a book coming out next year. So I wear a bunch of different hats, all under the umbrella of women's mental health and really trying to empower and educate women about their mental health. So, of course, I'm super excited to be here to talk with you today.
Yes, yes, well, me too. And today we're really going to talk about how to navigate Mother's Day, which is coming up, just a couple of weeks. And if you are somebody who maybe is struggling with trying to conceive, or undergoing fertility treatment in some way, and I know from personal experience how hard that can be. It took me a few years of trying before I was able to conceive my daughter Neva through IUI. So yeah, particularly those last couple of Mother's Days I went through, where I was really sort of starting to lose hope. I found that time pretty tough. And I know you've had your own journey, to pregnancy as well. You're currently pregnant.
Yeah, absolutely. I am currently pregnant, but in 2020, in fall of 2020, so almost 2 years ago, I had a miscarriage, and that was after trying to conceive for about 7 months. And at that time, I was, that horrible term that they use, advanced maternal age.
Mm.
We went straight to IVF, so I spent all of kind of last year going through the IVF process, which is any type of infertility journey is grueling.
Mm-hmm.
It was really eye-opening to me to be on the patient side of things, because of course I've worked with women as a physician who are going through it, and many women in my practice are struggling with infertility, and then to be on the other side and sort of be like, oh wow, this is really, really hard.
Mm-hmm.
Now I am 31 weeks today, and which is, I think once you get pregnant after infertility, it certainly does cloud the picture as well.
Yeah. Mm-hmm. Yeah.
But I'm excited to talk today, because I think Mother's Day is one of those holidays that really can be triggering for a whole host of reasons. And I'm glad that we're having this conversation to hold space for women who are ambivalent about Mother's Day, or conflicted about Mother's Day, or even just straight out hate Mother's Day,
Yes.
and don't want to have it and don't want to be part of it. I just think it's so nice to hold that space.
Yes. Yes. Um, well, as we've noted here, like Mother's Day, can be just a really difficult time for a lot of people for many reasons. I think there is a very particular type of feeling that arises for people who are, sort of quite, desperately trying to conceive, particularly if it's been a long time. And what are some of the emotional experiences of Mother's Day that that you've heard about through your clients or experience personally?
Yeah, well, I think it can be a time of, if you're in that place of wanting to become pregnant and trying really hard to become pregnant and having it not work, when you see friends or family members celebrating Mother's Day, or pregnant, or with new babies, it brings up envy, jealousy,
Mhm.
anger, grief. And those are hard emotions to feel. And it's completely normal, especially if you're somebody who is, who's struggling to expand your family, to see it come easily to others, and to see it work for others, and then be in that place where you still don't have it and you don't know if you will have it.
Yeah.
Um, it's one of the most difficult emotional experiences, I think.
It really is. I think it's one of those things that, you can, if you haven't gone through it, you can potentially have so much sympathy and compassion for, but until you actually experience it, similar to going through a miscarriage, which we both have, until you actually go through it, I feel like it is hard to truly grasp the dynamics of feelings around that. And you mentioned that it can be really uncomfortable, like to feel envy, to feel anger. It can be uncomfortable just to feel it, but actually to say it aloud, to anybody, right? To confide in somebody that you feel that way, I think is an even greater struggle for a lot of people.
Yeah, absolutely. And I think socially in our culture, people don't make a lot of room for that type of frustration or anger or grief.
Mm-hmm.
So it's hard to know who is a safe person to be able to share it with.
Yeah.
That adds to the struggle.
And it's true what you say about it being grief. I think sometimes it can be hard, for somebody who hasn't experienced that, to understand that, like, you can grieve something that you haven't actually, that it hasn't physically manifested, right? But the grief of your hopes that your path to conception will go a certain way is very real and deep.
Right. And I think one of the tough things about Mother's Day is that it happens every year at the same time. So if you've been struggling for years on end, it's sort of another reminder of, here's another Mother's Day.
Yes.
We're still not where we want to be.
Yes.
And that also makes it particularly triggering.
Yeah, that's so true. And what would your advice be to support, yourself if you're struggling to conceive or experience loss and you're finding Mother's Day challenging? And also, how can friends or partners or family members best support people who are finding it difficult right now?
Yeah, I think there's a couple things. One, recognizing for yourself that it's normal to feel these negative emotions, and that doesn't make you a bad person. So not adding more judgment onto yourself. You already have enough going on. And letting yourself kind of acknowledge that it is hard, and finding those confiding relationships in your life. Hopefully you have at least one of them, somebody that you can turn to and say, look, this May is going to be a hard month for me. I know it is. Can we hop on a Zoom? Can we chat? Can we text? Having a space to sort of let some of those messy feelings out. And sometimes that is a therapist or a counselor, and sometimes it's a friend who has been there as well. I think particularly in this type of life experience, it does really help to have other women in your life who've been through it as well. Because it is kind of a shared trauma. And if you haven't been through it, you can try and understand, but I think there's a different type of emotional holding that can go on when you have people in your life who've also either been there or are currently there, where they can lend an ear and provide a safe space for you to let out that frustration, let out that sadness, the envy, all of those difficult feelings. Yeah. The other thing I'll say is that it's really important to not get caught up in the performance. So what I hear from patients and what I've experienced myself too is, well, I feel really bad because I'm not being a good friend, and I should be happy for my friends that are celebrating Mother's Day. Like, there's a lot of shoulds, right? And worry that if you need to pull back, that you're a bad person, you're a bad friend, when in fact, it's actually really important during this time to take care of yourself and to give yourself the distance that you need.
Yeah. And I think too that people, again, can, if somebody's, truly your friend, they should be compassionate when you share that you really want to celebrate, let's say Mother's Day with them, but are just not able to right now.
Right. That
hard to say,
really are in your corner should be able to have that compassion. And in some ways it is a little bit of a litmus test to see who really can be there for you and who isn't capable of that. And the other question that you asked is how other people can support, perhaps family members or friends. And I think the biggest thing is just acknowledging, like speaking what is happening. So whether that's through text message or a phone call, just saying, hey, I know that you guys are on your own infertility journey. And so I imagine that Mother's Day is tough for you. I just wanted to let you know I'm thinking of you.
Yeah.
That goes a really long way.
Yes. Yeah. And then the short period of Mother's Day aside, if you're somebody, if you're going through years of fertility treatment or, trying to conceive, obviously that takes its toll on you emotionally and physically. What suggestions do you have for navigating that sort of extended period of, sort of round after round of disappointment?
Yeah, it's a really tough process for so many reasons. One being the extended grief that you're going through, constantly getting disappointing news. Also the uncertainty of not knowing if it's going to work out, and if it does work out, when it will. So two things. One, it's really easy during those time periods to feel like the clock is ticking and every month that goes by feels like a year, but really giving yourself space to rest and not feel like every month has to be another cycle or another IUI or whatever it is. Just I'm an advocate for breaks, really just kind of giving yourself space and time to digest and rest and not feel like you have to just constantly be on to the next round. I think the other thing too that doesn't get talked about enough is also the fact that all of this is a choice, that like you get to decide how aggressive you are, you get to decide when you move up to the next intervention, and it's a risk benefit, right? And each intervention comes with its own emotional toll, and every family has different priorities, right? So in my practice, I also work with patients who ultimately at some point decide, we've done everything that we feel comfortable doing, and we're happy, kind of stepping off of this treadmill too. That's a tough decision to make, but I think just like remembering that you have agency also.
Yes. What do you recommend? Because I assume this must happen quite frequently when somebody, if you're conceiving with a partner and your partner maybe is ready to end earlier, or not end early, but take things at a different pace than you, or vice versa. Like when there's that sort of disparity between couples over how to proceed. What do you recommend there?
Yeah, and it actually it's not uncommon, right? Because usually each person has a different tolerance for suffering, really, because it really is like, how much are you willing to suffer? So there's usually there's a kind of a volume dial where one person kind of is, you're hoping that you can kind of be on the same wavelength. I think that's a place, extended infertility struggles are really difficult on relationships. So that's one place where I often will refer people to couples therapy, because each partner has their own grief too, right? And so it's important that you can be able to sort of communicate honestly and openly what your worries are, and what your hopes are, and what your, those feelings of sadness, and, as opposed to just kind of jumping to like problem solving and like, this is what we're going to do. Because especially with the technicalities of infertility treatments, it can very quickly just become so kind of like logistical, almost project management,
Oh my God,
calendars and all this stuff, but kind of stepping back and actually holding space with your partner to get into some of those uncomfortable feelings. Like, what would it mean if we took a month off? What are my fears about taking a month off? Why do I think it's actually really important for you to have a month off, etc.?
Yeah. And it can be so hard to get there though. Like, like you said, sort of once you're on that treadmill, I think, I mean, I know personally there was a pattern of like, okay, if this cycle works, then that means I would be having this baby then, and like I would do that every month, and it was just sort of setting myself up for disappointment. And I think like if it is possible to kind of take a little time to break those patterns of thinking, I can definitely see how that would be it's just a kindness to yourself. What I know a couple of people who have been trying for such a long time and going through so much, they really actually want to get to the point of letting go in terms of thinking of maybe having their own biological child, right? Considering, truly following the path of other options, but want to get there, but haven't got there yet. Like, how would you recommend that somebody sort of navigate that kind of challenging time?
Yeah. So I think part of it is you can't rush that process because it is such a deeply personal process. And in some ways that comes back to kind of our earlier conversation of kind of like the performance that can happen, like the outside pressures that can happen. So, that one of the things that I really kind of emphasize with my patients is just looking really closely at the decision making that is inherent in this process, and remembering, the whole goal is, 5 years from now, you want to be able to look back and say, I feel like I thought about every option, and that I really reflected on what was the most important thing for me, what was the most important thing for my partner or my family. And you can't really rush that process. So I think especially for those who are sort of like moving towards that place of potentially being child-free by choice or other alternative options, that it's itself a process of grief and loss, and then kind of a rebirth as well of what could life look like on the other side. And that in itself is kind of its own hero's journey that really takes time. So, I do think that working with a therapist or a counselor who has experience in this field can be really helpful if you're in that kind of space, to be able to really explore some of those hopes and dreams and fears, and really kind of give yourself space to feel the grief that comes with making that type of decision.
Yeah. And there are therapists that specifically, are experienced in helping you deal with loss or, infertility and
yes,
like that. So definitely, if you can, like, worth finding somebody who's, really sort of well trained in that area for sure. And what techniques might you suggest for somebody who's struggling with Mother's Day for other reasons? Maybe it's because they are, missing a parent who's passed away, or because they have a poor relationship with their mother, for example. Like, how can people struggling with those kinds of situations as well, like, just care for themselves and just feel a little bit more neutral about these cultural holidays that might be a little, distressing?
Yeah, absolutely. So I think that's such a great question, because there's actually, many patients that I work with that for various reasons, Mother's Day is hard, because of difficult relationships with your own family and your own mother, or, loss of your own mother, like you said. So number one, I would say that it's okay to shut out social media, regular media, like mute accounts, even just, delete social media from your phone that day or that week. And really just take a beat and a space for yourself, because it can feel a bit like a bombardment, especially that week. There's just so much happening and coming out and kind of constantly in your face. So I think it's really reasonable and protective, if you're somebody who knows that that's a hard time for you, to step back and disconnect from those accounts and those places. Actually, interestingly, I've gotten a few emails from different brands that are completely unrelated to, mothering or women, who've said, you can, if you don't want to get a Mother's Day email from us, unsubscribe. This is the first year that I've seen that.
Oh, interesting.
like a mattress company, like
Right,
just
right.
totally unrelated. So I thought that was really nice.
Yeah, I like that
Um,
people are acknowledging that it can be hard for some people.
right, right.
Yeah,
And I think coming back to, again, if you have people in your life that you feel safe confiding in, setting up some extra support. So, setting up maybe a Zoom call for that week with a friend who's in your corner, or a loved one who's in your corner. Especially if there's been a loss, maybe connecting with your siblings during that week, just kind of like looking out for ways that you can give yourself more support.
yeah, I really like that. And also, I think you could find ways to just sort of uh, kind of ignore that day, or maybe even take it as an opportunity to do something really nice for yourself, to treat yourself to something in some way that makes you feel good.
Right, maybe feel connected to the person that you've lost. And again,
Yeah,
that's something that's personal to you. It doesn't have to be performative. It doesn't have to be coming from the outside. It can be
yeah,
something that's quiet and personal.
yeah,
That has the most meaning.
yeah. I really love that, and I love the the tips that you gave around just it is okay to draw a boundary with people. You can participate in their joy. Like, for example, if you're obviously baby showers are really hard sometimes to attend if you're really struggling to conceive, but it is okay to share your love with that person, but not necessarily attend if you would find it hard.
Yeah, absolutely. And I think sometimes there's fear around being transparent like that, like sending a note, or saying, I'm so happy for you. Here's a gift. Just based on what's going on in my life right now, I'm afraid that I just can't be there in person, but please know how happy I am for you.
Hmm, hmm.
Like there's a way to say it that can still feel really loving to the
Yes.
person who is receiving it, but also is honoring your own internal needs.
Yeah.
And again, a real friend would be able to hear that and receive that and understand. Um,
Yeah.
I
And
think
like
it's
with
a little bit about it is sort of like trusting that
mm,
your friendships can handle that level of honesty and authenticity. And the reality is that not all friendships can. And so, like we said, this in some ways it's a litmus test. But hopefully there are people in your lives who would actually be grateful that you are disclosing in this way and are doing what actually is helpful to take care of you.
yes, yes, exactly. And I think the more we all go through obviously
Yeah.
difficult times in different ways, and the more that we can kind of be open about that with people that we trust, the more compassion there will be. So
Yes, yes.
yes, thank you so much, Pooja, for sharing this. This will be coming out before Mother's Day, and hopefully it will be helpful for some people.
Absolutely. Well, it was such a pleasure to be with you. And for those that are listening, I am on Instagram at Women's Mental Health Doc, and my company is Gemma, and you can find us at www.gemma women.com, and we're a digital education platform focused on women's mental health. So I'm really excited to continue our conversations and our
Yeah,
collaborations. And thanks again, Mia.
yeah, me too. Thank you.